Thank you, Dr. Aziz.
Thank you, Mike.
Welcome, everybody, for this webinar with National Kidney Foundation of Wisconsin. Today, Dr. Fahad Aziz will be discussing diabetes and kidney health, and we really look forward to your talk. So please go ahead, Dr. Aziz.
Thank you, Carolyn. Just a brief introduction about myself. I'm Fahad Aziz. I'm one of our transplant nephrologists at University of Wisconsin. Transplant basically means somebody who is specialized in, taking care of the patients who have a kidney failure and then who have to undergo a kidney transplant. So that's why, this topic is extremely important for myself. Especially this month, November, 14th November was the World Diabetes Day. So based on, this month and this important topic, so today we are going to talk about kidney health in people who have diabetes. By this, I have basically divided my talk into three major areas. Initially we will try to understand diabetes. We'll talk about, what is diabetes, and we'll talk about some statistics about diabetes. Then we will move on how diabetes affect the kidneys. We will try to find a link between diabetes and our kidneys. And the major part of my talk would then go into, how can we prevent diabetes damaging our kidneys, and how can we manage diabetic kidney disease. With this, I will start my talk. I would start with a hypothetical case when I want you to meet our hypothetical patient, Sarah. She's a 45 years old female. She works as a nurse. She has a history of type 2 diabetes for over 10 years. Her diabetes has been managed through oral medications and insulin. And she has been on a combination of oral medications and insulin for over 10 years. But now she has been doing fairly well with her work. Everything is going fine. But now she starts noticing some unusual symptoms which were creeping in. She starts noticing more tiredness, which is more than usual. She starts noticing that she is waking up at night more oftenly, going to the bathroom to pee. She also starts noticing some feet and ankle swelling, which is also something new for herself. On top of these things, she also finds it difficult to catch her breath when climbing few stairs up. With these new symptoms, she decided to go to her doctor. And with these new symptoms, doctor performed few blood tests and urine tests on her. And then she learned that now her diabetes has started affecting her kidneys. And as a result, what they noticed in the lab that she has elevated creatinine, which is one of the markers of kidney function. And they also noticed some protein in her urine. With these two things together, we know that, now diabetes has started affecting Sarah's kidneys. If we look at this story, Sarah's story is not unique. This story comes to many people who have diabetes. At some point in their lifetime, they do face some kidney disease. Many people get diagnosed with these things, very oftenly. But the good news is that, the early detection is now available. People can be screened for any effect of diabetes on the kidney. And then a proper management of these patients can not only prevent diabetes to damage the kidney, but it can also slow down if the damage is already happening. Now let's talk about what is diabetes. Diabetes, as we know, has two types. We have type 2 diabetes, we have type 1 diabetes. Type 1 diabetes is when our immune system attacks and destroys the cells in the pancreas, which produces insulin. This is an autoimmune condition, and sometimes the kids are born with this condition. There is no cure of this disease, other than being on insulin. And of course, the ultimate treatment is the pancreas transplant. It usually shows up early in the life, and usually this type of diabetes usually show up in the kids. Type 2 diabetes, on the other hand, is very different. In this, the major pathology is that the pancreas is not excreting the amount of insulin which is required. And number two, the body also develops some resistance to insulin. Because of this diabetes appear later in the life, and this diabetes can go for several years without a diagnosis. Type 2 diabetes can be managed with the diet, with exercise, with oral medications, and insulin. And sometimes just by losing weight through bariatric surgery, can also cure type 2 diabetes. So we learned a very important difference here that type 1 diabetes is managed only through insulin and only treatment is the pancreas transplant. On the other hand, the type 2 diabetes can be managed through diet, exercise, and sometimes even with the weight loss surgeries. Unfortunately, 38 million people in US are, diagnosed with diabetes. So as I was telling about the Sarah story early in this talk, more than 38 million people every day face these kind of problems, and about 1 in every 10 people have diabetes in US. And unfortunately, 1 in 5 people don't even know that they have diabetes. Um, if we look at the uncontrolled diabetes, it can damage it. That's diabetes in medical world, what we call a syndrome, which means it can affect the multiple people. It can affect the eyes, causing blindness. It can affect the heart, causing heart attacks. It can affect our brain, causing stroke. And also, it's one of the most important cause of kidney failure as well. So as we can see that diabetes is common, more than 38 million people in US have diabetes. And then this diabetes can lead to damage in different end organs in our body, making it a major medical problem in our country and the worldwide. Now let's talk about kidneys. Kidneys are our essential organ. They are essential for our life. Everybody has two kidneys. They sit usually on our back. And what I define kidney is basically a filter in our body. Each kidney is made up of close to millions of small filtering units. These filtering units are called glomerulus. And as you can see, a picture of glomerulus on the right side of the screen is just work as a filter. Um, the way it works is that it gets the blood goes to this filter, it cleans up, and then the clean blood goes back to the body, and all the waste are excreted from the body in form of urine. Other than being a filter, kidneys do a lot of other jobs in our body that makes them essential in our body. Kidneys are responsible for removal of several toxins from our body. It's also responsible for volume management in our body. That's why people who have normal kidney function usually do not get any swelling. They do not get any fluid in their lungs because the kidney have a very tight control over the volume. On top of that, kidneys also play a very important role in electrolyte balance. Our body has several electrolytes, including potassium, calcium, sodium. Kidney is responsible to manage those electrolytes and keep them in a very good range where our heart and other body organs can work. Kidney is also responsible for final processing of vitamin D, which is essential for the bone health. And also, kidney is responsible for managing over hemoglobin in our body. Kidney does secrete a hormone called epogen, which send a signal to bone marrow to make the red cells for us. That's why the people who have a normal kidney function usually do not get anemia because anemia is tightly monitored, or hemoglobin levels are monitored by the kidneys. And based on those levels, kidney keep a close connection with bone marrow to make more or less red cells for us. As kidney is doing several functions in our body, as the kidneys start failing, people start getting edema, which means swelling in their ankles, in their feet. The swelling can be in the lower abdomen, swelling can be in the back, and sometimes even the fluid can be accumulated in the lungs, which is a way bigger problem. As the kidneys start failing, the electrolyte imbalance become another problem. One of the most important electrolyte which get imbalanced with the kidney failure is potassium. And hyperkalemia, or increase in potassium level, can be dangerous for our heart even. The hearts can stop if the potassium level goes up to a certain level. As the kidneys start failing, the kidneys are not able to excrete the toxins out of our body, and as a result, the toxins start building up in the body. One of the most important toxins which build up in the body is urea. As the urea level goes up, it causes suppression of our appetite. It causes foggy brain, and the people cannot think straight when the urea level is high to a certain extent. As the kidney function goes down, the hormonal secretion from the kidneys also get disturbed. And as a result, the kidney is unable to send the signal to the bone marrow to make the red cells, and people start developing anemia or low hemoglobin. As the vitamin D processing is also affected, these are the people where the bone health is also a problem. And because of the vitamin D deficiency, they become more prone to have stress fractures. Now let's try to find out a link between diabetes and kidney health. As the blood glucose level goes high and it starts filtering to the blood vessels of the kidney filter, it causes a damage to the filter. And as the kidney filter got damaged from the damaged blood vessels from high blood glucose, the proteins start leaking in the urine. Um, our body, as we all know, the body is made up of protein, and proteins are essential for our body to function. And as the filter get damaged, this essential proteins start leaking from the filter of the kidney. And as they filter through the kidney or the kidney filter, they start getting clogged up in the kidney tubules, leading to decline in kidney function and eventually a kidney failure. Unfortunately, the diabetes stay the number one cause of kidney failure in US. 1 in 3 people who have diabetes developed a kidney disease. If we look at the chronic kidney disease, different causes of chronic kidney disease, the 44% of the patients who have a chronic kidney disease have diabetes. That make the diabetes a leading cause of kidney failure, followed by high blood pressure, which is 29%, followed by other diseases, including glomerular diseases and polycystic kidney diseases. This is an important thing to understand here that diabetes stay despite all the treatments we have, despite all the management we do for diabetes stay number one cause of kidney failure in our population. There are several other factors which increase the risk of kidney failure in people who have diabetes. These include if these people have a poorly controlled blood pressure, if their diabetes is uncontrolled, they are smoking, and they have a family history of kidney disease. These factors even increase the risk of kidney disease higher in the patients who have diabetes to start with. Now let's spend some time on prevention and manage of kidney diseases in people who have diabetes. The single most important thing here for the management is the management of diabetes. For the people who have diabetes, we usually recommend a very strict goal for A1C. A1C is the number which determines how well is the glucose controlled over an average of 3 months. This number should be less than 7. If the number is running more than 7, that tells us that the diabetes is not controlled and that where the damage to the kidneys can happen. Most of the time, this number is monitored every 3 to 4 months in the patients to make sure that we can adjust the medications, diabetic medications, so that we can keep this number less than 7. There are several medications that are available for management of diabetes. These include different forms of insulin with different glycemic agents. And I will go a little bit on more details in this in subsequent slides. It's also very important that we monitor the diabetes closely. And the way we monitor the diabetes is by monitoring A1C number, making sure that the A1C is less than 7. Also in these patients, the kidney function should be monitored regularly, which include the creatinine level in the blood and the protein level in the urine. Number two important thing is that the blood pressure management in these patients is also essential. As I mentioned, that combination of high blood pressure with uncontrolled diabetes that what leads to kidney disease. So a more strict blood pressure control is essential in these patients. It's also important that we carefully select the antihypertensive medications in these patients. Antihypertensive medications are the medications which are used to manage the blood pressure. In the diabetes patient, the most important medications, and I will go a little bit on the physiology, and then we'll describe how the certain blood pressure medications are more help in the diabetic patients. Let's talk about the kidney filtering mechanism a little bit. So as I mentioned earlier, the kidney is made up of millions of nephron, and each nephron works this way. It's a filter, and the glomerular membrane works as a filter membrane. Our blood comes and filter through this membrane. The clean blood then goes back to the body, and all the waste products go in the urine, and we then pee them off. Every minute, a huge gush of blood is filtering through this filter process. And this gush of blood through this filter membrane is also damaging the filter membrane. So the best blood pressure medication we can use here is what we call ACE inhibitor class of medicines and ARB class of medicine. The most common medication in these classes are lisinopril or losartan. One of the job of these medication is to slow down the blood gushing through the filter every minute. And as a result, the pressure inside the filter drops, which and over time, over period, the damage happening to this membrane also slows down. With help of these medications, we can prolong the life of the filter, and also by dropping the pressure inside the filter, we can reduce the amount of protein leaking through the membrane. As a result, we can reduce the clogging up of the nephrons. By using these medications in diabetics, we can actually prolong the life of the filter and the life of the kidney overall. And I cannot stress the importance of healthy lifestyle changes in people who have diabetes. I divide them into three major categories. One is the better dietary habits, number two, the physical activity, and working on weight loss, and then smoking cessation. If we talk about the better dietary habits, adopting a better dietary habits and choosing varied combination of foods is essential step toward the kidney health. Consuming the right amount of the proper food is also extremely important for the people who have diabetes to prevent the kidney disease. Some important things, the people who have diabetes should always limit the amount of beverages they're taking and the foods which have added sugars in them. Similarly, cutting back on high carb diet is also essential. Removing skin from poultry before eating is also important. Similarly, the sodium also play an important role here. Sodium attracts water, so more sodium means there will be more issue with the blood pressure, and it can cause even more damage in the filter of the kidney. So the people who have diabetes, it's highly recommended that they should be taking the foods with low sodium in it. And as a result, we can reduce the damage happening in the kidney. In simple words, we have to be more intentional in our dietary habits if we want to prevent a damage to the kidneys. And these intention include, a healthy food. We need to be, taking good meals, but no snacks in between the meals. And there should be a gap between the dinner and before we go to the bed. These habits are important because they are essential to control diabetes. And the more better control of diabetes we have, the less damage we can cause to our kidneys. The few tips which I think are very important that we have to make eating an activity in itself. It means that we have to live by intention. We have to make a schedule what we want to eat in a day, and then we have to focus. What we can do to change our eating habits. And I would say it's not easy, but we have to stay positive and we have to take some baby steps every day to make this happen. If we move to the physical activity and weight loss, we all know that excessive weight and excessive fat in our body can lead to high blood pressure. It can cause uncontrolled blood glucose, high cholesterol, and increased risk of heart diseases. And combination of all these things together is not good for our kidneys as well. A balance between a diet and physical activity is extremely important, and the people start gaining more weight when this balance is changed. So we have to balance our diet with the physical activity we are doing every day, and it's important because that's how we can control the excessive weight gain, and which ultimately help us in controlling our diabetes, and ultimately is important for the health of our kidneys. American Heart Association recommends that 30 to 60 minutes of physical activity on most of the days of the week is essential for the adults. And what I recommend to most of my patients is, even getting on a treadmill for 5 to 10 minutes, 3 to 4 times a week is can actually make a difference. And sometimes even walk for a 5 minutes, 2 to 3 times a day, that all what we need. And that much physical activity makes sure that we don't get excessive weight. We can burn the extra carbohydrates we are eating, and then also that helps that we to control our diabetes, which is ultimately important for health of our heart as well as for our kidneys. Let's talk about smoking. Combination of smoking and diabetes can be very dangerous. It increases the risk of heart diseases. It can aggravate the damage in our blood vessels. And as I already mentioned, the diabetes can damage the blood vessels inside the kidney filter. So smoking can actually potentiate this effect even at a higher level. It can also lead to uncontrolled blood pressure, which is again a problem for the people who have a kidney disease from diabetes. So if we combine all those factors together, we know that with the smoking, there's an increased risk of kidney disease and worsening of kidney function. Again, quitting smoking is easy to say than being done. So we have to all make an intentional effort to quit smoking. It's basically an agreement between ourselves that we want to quit this smoking. There's always a fight to our inner self if we really want to quit smoking. But we also need to be aware that, quitting smoking, even cutting back on smoking, that helps a lot with the damage happening in our body with each and every smoke. Let's talk. Let's talk the next few slides about the treatment if you are diagnosed with the kidney disease from diabetes. Again, the better control of diabetes is essential. And more than any regimen, the most important thing is the A1C number. An A1C number of less than 7 is essential, which basically tells us that there is less damage happening to the kidneys. Now, there are different regimens available to the doctors to take care of this disease. These are insulin regimens. We have some classic diabetic medication, including metformin, and then we have a lot of new diabetic medications available as well. If I talk about the diabetes medications, especially for type 2 diabetes, many times we can control type 2 diabetes with the help of the medications. One of the most important medication is metformin. It's an old class of medications. The way metformin works is reducing the production of glucose from the liver and making our body more sensitive to whatever insulin is secreted by the pancreas. Now there are certain new medications that are also available. These medications are labeled as SGL2 blocker. The way these medications work is very different. They have recently approved by FDA to use for diabetes. But these medications are extremely good because they prolong the life of the kidney. The way these medications work is basically they block the receptors in our kidneys to absorb any glucose which is being excreted in our urine. As a result, what happens is that they prolong the life of the kidney filter. They can also reduce the protein in the urine. These medications are also essential for the heart health as well. These medications can also help to reduce the weight. So by doing all those things together, these medications can be extremely good to reduce the damage happening to the kidney from the diabetes. Let's talk about hypertension. In high blood pressure is, as I mentioned earlier, the high blood pressure can actually potentiate the damage happening by the diabetes in our kidney. So a tight blood pressure control is extremely important in the people who have diabetes and the kidney disease. Again, when we have to pick up a regimen for blood pressure medications, the most important regimen is lisinopril and losartan. As I mentioned earlier, these are the medications which reduce the pressure inside the kidney filter, and as a result, these medications can prolong the life of the filter. By reducing the protein in the urine, these medications can also prevent clogging up of the filter. There should be a stepwise increase in the blood pressure medications. The doctors can make several combinations of the blood pressure medications so that they can control the blood pressure more tightly and can reduce the damage which is happening to the kidney in people who already have damaged filter from the diabetes. Again, the lifestyle modifications are extremely important. I can't stress the importance of dietary modifications, which we can easily do it. Physical activity is also extremely important for the control of diabetes as well as for the kidney health. Smoking cessation in these patients is also very important. A good night's sleep and a stress-free lifestyle is also extremely important to have a better blood pressure control, have a better diabetes control, and ultimately have a better kidney health. One of the most important thing is a careful monitoring. When people are diagnosed with diabetes, one of the thing is to carefully monitor their kidney function, monitor their blood pressure, monitor their glucose, and then have a close monitoring for any complications which can happen from diabetes. A close examination of their eyesight is very important. Monitoring of their risk factor for cardiovascular disease is also very important. And what the doctors do when they're managing these patients is that they have to monitor their A1C number regularly because that's the number which determine if there's any changes need to be made in their diabetic regimens. Similarly, a close monitoring of kidney function is very important, and this includes two tests. We have to monitor the serum creatinine in the blood, and then we also have to monitor the protein in the urine. The combination of those two tests can tell us the health of a kidney in people who have diabetes. It's also important for the doctors to have a timely referral to nephrologists, and nephrologists are the doctors who are taking care of the kidney diseases. Whenever the kidney function if start getting affected by the diabetes and it start going down below 30, which means they have a chronic kidney disease stage 4, that's the point where they should start seeing the kidney doctors. Whenever the primary care doctor notices more protein in the urine, blood in the urine, or there's an issue with uncontrolled blood pressure, these are all the indications when the patient should be referred to a nephrologist. And the job of nephrologist is basically to slow down the kidney disease, to take every measure to slow down the progression of the kidney disease. Nephrologists are also heavily involved, if the kidney function keep going down way to what kind of access, is good for that particular patient. They also make decisions what kind of dialysis and when is the right time to start a dialysis for these patients. And also the most important thing for them, if they feel like this kidney is going to go away, when is the right time to make a referral for kidney transplant. Um, that's why a timely referral to a kidney doctor in these patients is also very important. With this, if I go to a conclusion, I would say that diabetes and kidney disease are closely linked with each other. And as we have seen, the diabetes stays number one cause of kidney disease in these patients. We can slow the progression of kidney disease if we can have a good control over the diabetes. Similarly, early interventions, like having a good blood pressure control, having a healthy lifestyle, we can slow the progression of the kidney disease. Management of blood sugar, blood pressure, healthy habits, better nutrition, physical activity, smoking cessation all have a significant role in slowing the progression of kidney disease in the people who have diabetes. Similarly, the regular monitoring and timely referrals to specialists is also crucial in these patients. If I talk about some take-home messages from this talk, I would say that diabetes is common, but does not have to lead to a kidney failure if we are able to manage it effectively. Everybody, who have diabetes is a high risk for a kidney disease. And as I mentioned earlier, almost 1/3 of the patients with diabetes have a kidney disease. It's important that we monitor this disease closely and, we prevent the kidneys to be damaged from diabetes. And if somebody's kidneys is already damaged, we can slow the progression of a kidney disease in those patients. With that, I will stop here and I will be open for any questions.
Thank you so much for that talk, Dr. Aziz. And if anyone wants to drop additional questions in the chat or in the Q&A, I'll be happy to moderate those. We do have a few questions that were submitted in advance. I know you covered several of them in your presentation, but I'll call them out. If diabetes is well controlled, can you stop worrying about your kidneys if that A1C is under control, or should you be worried about it the whole time?
That's an excellent question. I think even if the A1C is less than 7, we should still monitor the kidney function. The most common reason the damage happen is more A1C more than 7. But in some people, who have kidney disease in their family or who have uncontrolled blood pressure, in those patients, even an A1C less than 7 can also be damaging to the kidneys. So we usually recommend that anyone who has diabetes, even if it's well controlled, we still need to keep an eye on the kidney function.
Within that, could you explain a little bit about the difference between seeing a urologist versus a nephrologist?
Yeah, the simple difference is that, urologists deal with a plumbing problem. So any problem with the ureters, with urination, with bladder, that's what urologists really treat. But any problem with the kidney itself, the filtering function of the kidney, or any other function, hormonal function of the kidneys, that's where the nephrologists have a role. And if I go one step ahead, dealing with dialysis access, making referral to, transplants, this is all what nephrologists do.
Thank you. I know it's a question that comes up a lot. Are there any specific foods to seek out or avoid, or a diet plan that can be helpful in managing diabetes and kidney disease?
Oh, absolutely. I think diet is one of the essential component of this whole management process. And the journal rules are same as the healthy diets we eat, less carbohydrates, more protein, sufficient amount of fat in our diet. Any added salts, we should be avoiding those things. I think those things are essential. These are healthy habits, healthy diets, which we should incorporate. Um, and then there are some essential dietary habits which are important. For example, we should always discourage to have snacks in between the meals. A good meal is better than having snacks in between. So there should always be a gap between the meals. And also there should be a gap between dinner and when we go to the bed. There should be a gap of at least 2 hours between those two events. So I think those are the habits which are essential, even if people do not have diabetes or kidney disease, those are healthy habits which we should adopt.
That 2 hour gap before bed is hard. Why is that so important?
Because if we eat something and we go to bed, that all what we eat, it's going to be converted to the body fat. Body has no time to burn this out. So there a gap is important. So that gap and even a small walk before we sleep, I think is important because that it means that we burn already what we ate in the dinner.
You explored the difference between what type 1 diabetes and type 2 diabetes is in terms of how it presents with kidney disease. Does the cause of the diabetes make a difference in the risk to the kidneys?
Not really. I think the most important thing is how well controlled the diabetes is. Either it's type 1 or type 2. I think they have to be well controlled if we want to prevent a damage to the kidney. I do think there's some differences in terms of presentation. For type 1 diabetes, they are usually diagnosed early in the age. Usually it takes 10 to 12 years for type 1 diabetes to damage the kidneys. On the other hand, type 2 diabetes is not usually not diagnosed in time. So sometimes those people can present earlier, with diabetes as compared to type 1 diabetics. And many times, we are actually, get patients, who have a kidney disease, and then we kind of find out that they have diabetes, and nobody ever told them before that they have diabetes. This usually happens with type 2 diabetics.
Thank you so much. Those are all of the submitted questions. I'll pause for just a moment if any of our attendees have additional questions to add. Again, feel encouraged to drop those in the chat or the Q&A. While you're doing that, I forgot to give my disclosure at the beginning, but I will give it now. That all evidence provided as part of this, or all topics as part of this webinar are for advisory purposes only. Obviously, a quick chat online is not a replacement for seeing your care team, but we always like to call that out in particular. And seeing no additional questions coming in the, oh, I do see one in the chat. I apologize. Oh, it's just a thank you. And we are grateful for this time and for this talk. The recording is going to be posted in the next week or so to National Kidney Foundation of Wisconsin's YouTube. And oh, we have one more question. How long after maintaining an A1C of 11 or higher can a person with type 1 diabetes develop kidney failure?
Sorry, the A1C of how much? Less than 7?
11 or higher.
Yes, so 11 is fairly high A1C. So I would say the damage will happen very quickly. Kidney is one of the last organs usually affected by diabetes. So an average time from diagnosis of diabetes to kidney disease is somewhere between 8 to 10 years. The first damage usually happens to eyes, or eyes is one of the first sign. But after damage happening to the eyes, damage to the kidney is usually going to happen. So I would say, depending upon condition, the average is between, close to 8 years, where most of the people are diagnosed with diabetes.
Thank you so much. Any addition? Oh, another question. Just thanks. Thank you for answering that. I'll pause again if we have any more questions coming in. And I want to thank you again, Dr. Aziz, for this talk, and thank you everyone who signed on to join us today. Whenever you have questions about your kidney health, National Kidney Foundation of Wisconsin is here to help. So feel free to reach out to us anytime, and that can be done at info@kidneywi.org. So with that, I think we can conclude. Thank you, everyone.